Hi everybody, my name is Mark Sanis with Sanis Insurance, and I'm here today to talk about the Inflation Reduction Act and how it affects Medicare in 2025. It is going to greatly impact Medicare, especially the prescription drug coverage. So stay tuned, let's move on to the next slide and explain what is currently going on and then what this plan does in the subsequent years. So right now in 2024, each Medicare drug plan, whether it's a standalone plan, prescription plan that works with a supplement or Medigap, or if it's included with your Medicare Advantage plan, it has four phases to it. A deductible phase, the initial coverage phase, the coverage gap or donut hole phase, and the catastrophic coverage phase. Now on the deductible phase, basically when you have a tier 3, 4, or 5 medication, you're subject to a deductible, and you need to pay the amount, and it can go as high as $590 annually, especially for the standalone plans, and you do have to pay that. Now, if you're just on a tier 1 or 2 medication, just generics, you might not be subject to the deductible, and you wouldn't have to pay anything. Now, deductibles, once you pass that and move into what we call the initial coverage phase, you're now going to be paying approximately 25% of your tier 3 and 4 brand medications. This is your copay going forward, and once the plan and the member for what they contribute to this equals $5,030 at some point during the year in 2024, then you move into what's called the coverage gap or the donut hole. And if you have any friends that know what the donut hole is, it can be rather expensive, because not only do you have to pay the average of 25% on your brand retail amounts, you now have to pay also 25% on all your generics. So it gets very expensive at that point during the year. And to move out of that area and go into the catastrophic coverage phase, the true out-of-pocket has to hit $8,000 for this year, 2024. If that happens, at near the end of the year most likely, you'll be in the catastrophic coverage range, and right now the members don't pay anything for their drugs once they're in that phase, and they just eliminated the 5% CAT coinsurance amount in there thanks to the Inflation Adjustment Act. So this is the current phases, these are the current phases for the drug plans with Medicare right now. So let's take a look at what the Inflation Adjustment Act is going to do. And it actually is a bill that got started and signed in 2022, and it effectively started in 2023. So last year, the Part D vaccine coverage medications were expanded, and they went down to no cost. If you ever had shingles, you probably are going to tell your friends don't get it, and get the shot if you can. Shingle shots, it's Shingrich, I believe, is about $200 a shot, and there are 2 shots. If you're on Medicare right now, they're no cost, and I would highly suggest looking into that. Also, they developed an insulin savings program, and insulins used to cost approximately $500 copay a month. Now they're down to $35, so that's fantastic for a lot of people. In 2024, right now, this year, they eliminated that 5% coinsurance for the catastrophic phase, so that's great. In 2025, this is the big one, they're going to reduce those limits that I just talked about, the $5,030 and the $8,000 limits, moving from the different phases down to $2,000 a year. So the most you will pay for your out-of-pocket prescription drugs next year is $2,000. Now that's still a chunk of money, and this will help about 14 to 15% of the population. But it does eliminate that coverage gap, so you don't have to pay even more on your drugs. They've also developed a Medicare prescription payment plan, and if you have drugs that do qualify in cost-wise, you can then schedule these payments out, 12 months, It's approximately $167 a month times 12 is right at $2,000. So that you don't have to pay a large amount at the beginning of the year. You can spread the payments out. It doesn't reduce your cost of the drugs, but it does help the payments get spread out for you. Also, you need to sign up for this plan with whichever carrier you're with at the time. You don't automatically get it, so you need to sign up if you qualify. All right, in 2026, 27, 28, 29, for the very first time, Medicare is going to negotiate with the pharmaceuticals on prescription costs. And they have agreed to do anywhere from 10 to 15 to 20, depending on the year, high-cost prescriptions. And they will sit down and negotiate those prices, and then they'll let the public know at that time. So that's a good thing as well. So this is the Inflation Adjustment Act. Now, is it a good thing? Or are there negatives as well? So here's just a quick view of who pays. So in 2023, you can see up here the 4 different phases we just talked about: the deductible, initial coverage, coverage gap, and the catastrophic. The dark blue are the enrollees. Those are the members, yourself, that have to pay these portions of these coverage areas. So you do have to pay your deductible, you do have to pay 25% of the initial coverage section, and then the coverage gap section was 25, and you did have to pay a little bit of catastrophic in 2023. In 2024, right now, you'll see that the CAT coverage, you don't pay anything. Other people are paying for your medications at that point, but you do still pay for your deductible and the 25% between the two. Even though the coverage gap now is going to be eliminated in 2025. So you'll notice just 3 phases. Yes, you'll have to pay that deductible, and yes, you'll have to pay a little bit of initial coverage until you hit $2,000 amount, $2,000 out of pocket. Then it stops, and you're good to go. And other areas will be paying. So the purple is the Part D plans, the carriers themselves. The blue is the drug manufacturers chipping in, and the green is Medicare itself, CMS, the Center for Medicaid and Medicare Services. So you can see how it's changing from 4 phases down to 3, and who pays what for each phase. Now, let's take a look. Are there impacts, and what is positive and what's negative about this? Well, first, we just talked about all the positives. The vaccines being expanded and lower costs, that's great. The insulins being capped to $35 a month for their supply, that's great. Elimination of the 5% coinsurance for the CAT coverage, awesome. The maximum out-of-pocket reduced from $8,000 to $2,000, that is fantastic. But remember, that's only about 14 to 15% from what we're hearing of people that it affects. Elimination of the coverage gap, that's great too. Medicare prescription payment plan that they developed to help spread out the costs, that's great. And Medicare finally gets to negotiate on 10 to 20 high-cost prescriptions each year, 26, 27, 28, and 29. So a lot of positives there. It sounds great, doesn't it? But there's more to the story. As Paul Harvey would say, there's more to the story. So there will be major changes for this annual enrollment period, starting October 15th through December 7th. The carrier Medicare plans, many of them will be leaving your state. I'm not kidding. There are quite a few carriers that, because of the restriction of the $2,000 limit, that means pharmaceuticals are not making as much profit, correct? So if that happens, what do you think they're going to do? They're going to raise their premiums on the prescription plans they have, and they're going to increase the formularies, generating more cost on your co-pays. So what has that done? That has hit the Center for Medicare Services as well, and they now are reducing the amounts of money that the carriers get for these plans. And the money they get helps the benefit, pay for all the benefits and keep the premiums down. I truly believe they'll still have a lot of Medicare Advantage at $0 premium, but the benefits are going to greatly change in what's offered, if anything. I should say they will have benefits, but there's going to be a reduction of benefits. There's going to be a reduction of how much they pay for each benefit as well. I have seen some, I'm privy to a lot with being an agent, but I can't really say anything much until October 1st, which is right around the corner. So once that happens, then we can talk about it, and then on the 15th we can actually write you up for plans for next year. So Medicare Advantage plans, they'll have decreased benefits and increased prescription copay costs for sure. Standalone prescription plans, definitely increased premiums and increased prescription copay costs. And that $2,000 cap, which sounded great, guess what? It doesn't include the premiums. If a carrier decides to charge you just, for example, say $40 a month, instead of a couple of carriers who were almost down to zero in the past few years, guess what? That's 40 times 12 is $480 you have to now pay in the premiums, and you still have to pay that prescription deductible too, which is up to $590. That's on top of the $2,000 of the copays. So it still is going to be expensive if you reach that level. I kind of foresee, yes, they brought this cap down, it's great. However, there's going to be a lot more people hitting that cap now because of the increased premiums and increased formularies. So while it is good for certain situations, it might be really interesting this year for sure on the drug plans going forward. So what is the bottom line of all this? You're going to see a huge variation in premiums, co-payments, and covered drugs during the annual enrollment period this year. You're going to be receiving what we call the annual notice of change document. A lot of you don't read that. I highly suggest you read that this year, because that's what your carrier is sending you about their changes to your plan for next year. And they're required to send that out to you in late September, which is right now. So when you get that, read it. You're going to find there are a few carriers that are going to be sending you notices saying they're pulling out of the market. They're not going to be in your state anymore. So you need to change and find a new plan. There are going to be carriers that are going to say, we have 6, 7 plans, we're only keeping 3. 4 disappearing. If you're on one of those 4, you're going to have to change. You're also going to see changes of benefits. Some plans may be great the way they are right now, but the benefits totally change. Maybe they drop dental. Maybe they change the amounts on certain areas. Check it out. On October 1st, it's when agents, independent agents, can talk about all this and actually go in and look at our software and take your information specifically of your medications, your doctors and providers, and also what you are looking for, what your needs are for a plan, health plan, and the benefits. And so basically we'll look at all of those for you, and then we'll review it, and we'll go get back to you and just kind of go over your options. We'll tell you basically, hey, your plan is good for next year and it seems to be covering what you want, and the prices haven't changed much, so you're good, and we recommend you stay. Or we're going to suggest, wow, there's been a few changes, you might have a tier 3 now instead of a tier 1 or 2 medication. A lot of benefits may have changed. Maybe you're on one of those plans that left the market or left that carrier, and we need to move you. So we highly suggest that you get with your independent agent and go over this very thoroughly. I usually have maybe 10% of my client base wanting to switch every year for various reasons. And I think we're going to be upwards in the 70% of our client base wanting to shop in and look. So I've already sent out notices to my clients. There's a link here you can see for Retire Flow. That's just the name of it, but it comes directly to us. If you fill that out, It'll ask what your medications currently are. It'll ask who your doctors and providers are that you want to work with, and it'll have you sign a permission slip that I can talk to you with. And every agent needs a permission slip. It's called a scope. And you can sign and do all of that right there with this link, and it'll come directly to us, no one else, and then we'll run it for you. And there's no charge for our services. Never a charge for our services year-round. We get paid by the carrier if we sign you up. But if you want to go on your own, you can. We're here just to make sure that you get a good understanding of your choices and what's out there. Because this is going to be one disruptive year, believe me. So we also have what we use a calendar. Our calendar is called Calendly at Sanus Insurance. And so you can click on that link and actually schedule an appointment right now. You can start on October 1st and going forward through December 7th. Or you can call us, 509-993-9887. We'll be glad to speak with you, find out if you have questions, and then hopefully we'll do a quick med run for you and figure out which plan really is the best for you. You can also go to our website, sanusinsurance.com, and take a look at all the information there. We do make it very easy for you. And obviously our services are no charge. Just a little bit about us. We've been in business for quite a while. We are actually licensed in 12 different states right now. We're home based here in Spokane, Washington, and most of our clients are here, but as they have moved to other states, we've got appointed there. So we are in 12. We are also appointed with over 30 carriers. And that's a lot of tests I have to take every summer to stay current. But that gives you the benefit of making sure you get the right plan for your needs. Also, check us out on Google. We have a lot of 5-star reviews, and I think the best recommendation you can hear is from a business's clients. So check that out. And I just want to thank you. I know this is going to be one crazy year, especially for us agents, because we want to help you. But I've already got so many rewrites just from my clients having their plans changed. So I highly suggest you get with us quickly. And I've challenged all of my clients to tell their friends that if they need help, if they don't have an agent or they haven't heard from them for quite a while, and they just want a quick checkup, we can do that for you. We do have the capacity. So give us a call, give us an appointment. We'll help you out, and especially if you have lots of questions. So thank you very much for listening, and we look forward to hearing from you. All right, bye-bye.